We are an independent community advice centre based in the centre of Blackbird Leys. We provide social welfare advice, which includes things like family issues, housing and employment. But our biggest areas of focus really are benefits and debt. So we're very much about income maximisation and helping people to find long-term solutions and reducing poverty. We had to switch our services. We've always been very much face-to-face, and we've switched to delivering most of our advice by phone. We've had quite a few people that just haven't had phones, so they've knocked on our door, and because we've still been there, we've then been able to get them a grant to get them a phone so that we can then phone them and get them the advice that they need. In January this year, the numbers we saw were up by about 40% from the same period last year. And also about 40% of the clients for January were new people as well. About 40% of the new people we saw had COVID-related inquiries. And I think in terms of what people are coming to us for, there's similar things to what we've always seen people for, that they've drops in income and sudden changes in circumstances. But it's probably a broader range of people because it's being impacted by COVID. Really, that grant has gone a long way to allowing us to maintain the service. Because the fundraising burden was reduced, really it just meant that I was able to pitch in and focus all my time on the service delivery, which we absolutely needed because we had to set up our IT to enable people to work from homes. We've got a new telephone system so that every calls can be transferred to advisors at home. We're doing more. We've done some video calls with clients, and then we've worked really hard to make the centre COVID secure for people who are still coming in to the centre and for staff, obviously. Then advisors have had a lot of keeping up to date with the changes in legislation to make sure all our advice is accurate. An endless amount of adaptation, really. We're going to need to be very flexible still to adapt as things develop. So we want to keep in touch with the local residents. Every year we do feedback surveys, and we contact quite a few of the people that have used us over the year to get feedback on their experiences of us. We really want to do that a bit more than usual this year to make sure that we're asking local people, what it is that they need, and to make sure that we're adapting accordingly. And for instance, I think we probably will stick with delivering some advice by phone, and aim to make sure that the face-to-face advice enables us to help to reach the most vulnerable clients and those with the most complex cases. And sometimes we've found, there really is no substitute for face-to-face advice, and we want to make sure that gets to the people that really need it. I think one of the things I hope that will come out of this as well is that I do think there's a lot of goodwill around at the moment to people, and I think what I'm really hoping is there's much less talk about strivers and skivers, and that people will realise that difficult circumstances, change in fortunes can happen to anyone.